Roger Harriott is the head coach of St. Thomas Aquinas in Fort Lauderdale. Last season, his team, the Raiders, went undefeated on their way to a state title. Coach, it's good to have you. Thank you for being here.
Thanks, Scott. I appreciate you guys having me on.
You've heard our conversation with Dr. Gottlieb, I presume, and how you're thinking about what lies ahead for your season. How are you thinking about things tonight?
Well, right now we are fixated on putting together the appropriate protocols and parameters. Our principal, Dr. Denise Aloma, and our administrators, along with the governing bodies of the Florida High School Athletic Association, our Broward County Athletic Association, and various help from different coaches. We're just focused on doing what we feel is in the best interest of our kids in the community. That's our focus right now. We want to make sure that they're following the appropriate protocols with the 3 W's. Wear your mask, watch your distance, and wash your hands. So we're doing as much education as we can and following from a leadership standpoint to ensure that they're doing what is expected of them off the field.
I know how serious a business football is down there, particularly your high school. You've had Hall of Famers come through there, most recently the Bosa brothers for the NFL fans who follow things. Do you think you're going to have a season as it stands right now?
Well, as you know, football is a way of life down here in South Florida, and we're trying hard to put together the appropriate accommodations to fulfill those type of requirements and requests. However, we were optimistic, extremely optimistic up to the past, obviously, week and a half. We had a tremendous increase in numbers with regards to the cases of COVID-19. So, it's important from a leadership standpoint to look out for the best interest of the child first. As far as moving forward goes, we're not sure at this point. July 6th was the actual start date for Broward County up to just recently, and I think that will be pushed back with regards to what's right in the best interest for our kids.
Yeah, preseason begins July 6th, not far away. Training camp July 27th. A lot of decisions have to be made between now and then. Mm-hmm. You talked about some of the precautions that are being taken. Can you let us in on what exactly you're doing as a program down there already?
Well, we're first of all trying to make sure that our kids and our community in general realize that the stigma of this virus isn't something they should be ashamed of. If you have it, or if you know someone that has been infected by the virus and you spent a substantial amount of time with them, we're encouraging them to get tested. And so we want to try to put together a track and trace so it doesn't continue to spread. And we want to make sure that we are taking the appropriate measures with regards to the protocols that are in place. Obviously, if we were in a position that we could work out or start training, we would be encouraging social distancing. We would be encouraging temperature checks. Our governing bodies has put together a symptom form that has cough, nausea, any type of symptoms that you may have, including, fever. And we're taking the appropriate measures from there. If they have anything, then we encourage them to go home and get seen by a doctor and then do the track and trace from that standpoint. We truly believe that adversity breeds opportunities for us to make some difficult choices and decisions from a leadership standpoint, where that has been a struggle, obviously, so far within our community and within our climate. But we're doing all the things necessary to ensure that we're not compromising the health and well-being of our student athletes moving forward. So we're trying to encourage them to take care of themselves and not infect their families as well. So even though our young populations seems to think that this is a virus that they can deal with, they're not taking into consideration that they are going to track this back home to their family members and may put them in a difficult situation with regards to their health. So a lot of education is going on right now. We're doing our best to ensure their well-being without compromising the integrity of what our position from a leadership standpoint.